Hello and a very warm welcome to the latest World Horse Welfare Wednesday webinar. Always a mouthful to get that out, so I do a practice run with you, our Zoom audience, while Basil will just bring up very shortly our Facebook Live audience. So thank you very much for joining us this evening, and delighted to welcome also our viewers by Facebook Live for the latest of the World Horse Welfare Wednesday webinars, which this evening I'm delighted that we are being joined by Professor Pat Harris and Nikki Jarvis, and we're going to be talking about the older or the geriatric horse. I think I like talking about the older horse, the geriatric horse. So it doesn't sound quite right, but we're going to be focusing on how we can best care for and manage them, and discussing some of the age-related concerns we might commonly face with our horses. And I can tell you, both the areas of geriatric or older horses and nutrition is a real passion for both Pat and Nikki, and I'm sure that's going to come through in our discussion tonight. Now, as ever, this is a two-way conversation. So if you are on Facebook, then please do share the live feed, and we really want your questions. The format for tonight is going to be slightly different, so we're going to have there aren't going to be any presentations, but we've got a structured sort of Q&A with Nikki and Pat to start with, and then that's going to last about sort of 40 minutes or so. And then it's very much over to you guys. So please, if you're on Zoom, use the Q&A function to give us your questions. And do remember, if you're on Zoom, you can upvote questions that are already there. And if you're on Facebook, then please put them in the comments section. Also, if you're on Zoom, you can also use the chat function, but please don't put any questions in there, because it's much easier for me just to look in one place. My brain is small and I can't generally look in two. So that's very tough. If you enjoy today's discussion, then please do tell others and share it with your friends. And do remember that all of tonight's webinar and all our previous webinars are on our YouTube education channel. So please do go search them out there. We are doing our webinars on a fortnightly basis. And so if there's a topic that you would like us to cover in the future, then please do let us know by simply emailing us at education@worldhorsewelfare.org. And in a fortnight's time, which is the 9th of March, God, the third month of the year already, where's time gone? Can a stable horse truly be a happy horse? Something that often generates a debate. And I think that we got two wonderful people, Professor Andrew McLean and Dr. Brad Hill from Nottingham University, will be joining us then in a fortnight. And we'll put a link in the chat for you to sign up. Now, I'm going to start by sharing my screen if I can, and just why can't I share my screen? Let's well, we've got a poll question for you. At the moment, I can't seem to find the poll question, so I'm going to tell you what the poll question is. At what age do you consider a horse to be an old horse? If you're on Zoom, we've given you a series of options there. If you're on Facebook, just tell us what age you think a horse is an old horse, and we will come back to that in a second. Now, I'm having a bit of a technical glitch here, so I can't share my screen for some reason. So I do have two slides to introduce Pat and Nikki. So I'm gonna just have to do it sort of, you're gonna have to take my word for it, that everything I say is true. But Professor Pat Harris will be known to many of you, is an international recognized authority on nutrition. And I thought I love this quote from Claire Barfoot, who works with Pat at Spillers or Mars Horse Care UK, and she says Pat is always very reticent about attention being drawn to her internationally lauded achievements in equine nutrition, but all of us at Spillers feel extremely proud and privileged to have her as part of the team. And I can't think of any better sort of summary of Pat. She was a past president of the British Equine Veterinary Association, and she's passionate about equine welfare as well as nutrition and the older horse. Is a long-standing member of the Veterinary Advisory Committee of World Horse Welfare, and also is very involved with the Donkey Sanctuary as well. And so, Pat, we're delighted to have you. As your quirky fact, I know that you've had the older older girl called Sherry, who you kept going with no teeth for the last 15 years, which immediately put you in the sort of the mad brigade. But Sherry's very, very lucky as a result. So I know we're going to come back and talk about Sherry later on. So Pat, thank you so much for joining us tonight. And actually, Pat and Nikki Jarvis, who is started life in the mid-90s as an intern at Red Wings Horse Sanctuary. Many of you will know of Red Wings Horse Sanctuary, and Nikki has never left. She is now head of, I think, the director of clinical veterinary work at Red Wings. A quirky fact I love about Nikki is the fact that she was the first intern at Rossdale's veterinary practice in Newmarket. Now, I did a bit of research, and you can look at Nikki and you can think, well, she's very young, but Rossdale started in 1959. So I'm guessing they didn't have interns back in 1959. It's a bit more of a recent thing. But in her time at Red Wings, Nikki obviously has built up a wealth experience about dealing in sanctuary care, many of those horses, which would be older horses. So you have, in terms of our panelists tonight, two of the best, which is brilliant. Now, before we go on and talk about the different discussion topics we've got, Basil, are you going to let us know what the answer to the poll is? What do people think is an older horse? Well, look at that. Most of you think over 20 years, but a third thinking over 18 years, but almost all of you over 15 years. I was in the army previously, and back in the early 90s, horses were generally retired at 15. But now, as we see, horses are still competing at the top level at 15. So that's, I'm sure we'll come back to that, but a good spread of answers. So thank you so much for getting involved in that. Now, as I said, there's no presentation tonight. Basil and Alana are working us hard. So we're going to go straight into some sort of general questions first. What do you think, Nikki, coming to you first, what do you mean, what would you mean by an older horse, and when do you think we should consider a horse as old?
Well, I was slightly gutted that I couldn't vote because it might have been the only thing, I get right in the only quiz. So in actual fact, when it comes to research, I guess they needed to pick an age at which horses were considered old, else how can you take studies forward? So in actual fact, anyone who chose 15 plus is technically right. The reason being demographics. So when they look at any type of population, so dogs, cats, humans, if they want to look at the age at which we technically might consider them to be old, you would look at demographics. So you'd look at a population as a whole and look at sort of what age you start to lose people from that population and percentages in each group. So when you look at it from a demographic point of view, it's 15 and over. Now, interestingly, though, and I'm interested to hear what Pat thinks, the studies that looked at demographics, they were conducted in certain parts of the UK and quite a few years ago now. So it would in fact be quite interesting to redo it because as things go on, as we get better at veterinary care, as we learn more about these old horses and how we can support them, I do wonder whether or not the demographic age will increase a little bit. So that would be kind of interesting to look at in the future. Yeah. And obviously every horse is an individual. So I have seen some 15-year-old thoroughbreds that look considerably older, but we all know the 15-year-old Shetland pony that can still give you a run for your money and you're unlikely to catch it. So yeah, it is very much based on individual genetics as to how good they look for that age. But yeah, as regards studies, it's usually 15 and over.
But I knew a 45-year-old Shetland that gave you a good run for his money. Pat, what's your take on that?
I totally agree with Nikki. I think that it probably would change. That now, if we did those same studies, I think the demographic age would be nearer to 20, probably. Certainly, we've just done a big survey in America, and sort of about 70% of horses that retire for health reasons are retiring between that 15 to 24 years. So it seems to fit. But I would really honestly say the big message, it's individual. I think we have to be individual, because if they've had a hard life, and also what do you want from them? I mean, top class dressage horses are probably at their peak sometime about 15 to 18. But if you're going to do, as you were saying, your horses, Rowley, they're no longer in that. So I think it's horses for courses. It definitely is what you're needing. And I also think that your bit about the pony is really interesting, because we've done some study just looking at things like their bacteria in their gut. And horses and ponies may not be the same. I mean, we know they're not the same. But when we looked at age and the microflora in their gut with some researchers in both in the States and up in Liverpool and Shrek, we basically found that as horses got older, and they were the same age, but two different studies, horses and ponies, horses showed a decrease in the diversity of their bugs in their guts. So they actually were less diverse. But ponies are similar diet, all forage diet, similar age, they actually showed a slight increase. So that actually it may be that we have to be careful about a physiological age. It might actually be the individual animal, you know, how their joints, how their guts, and there would be a genetic. So individuality, I think. But in general, somewhere around 15 to 20, things start to change.
Brilliant. So, Pat, you've started to talk about sort of nutritional point of view there. And what are the main things that change with age in apparently healthy horses then that do sort of define them from a nutritional point of view as the older horse?
Very interesting point, actually, because again, the older research, if you go back to the older research, they would say that as horses get older, they start to show changes. They reduce, for example, their protein digestion and their phosphorus. But when we looked back at those studies, even the people who did the studies suggested they possibly made a mistake in that they weren't totally healthy animals. They may not have had good worming history. They may not have been maintained. So actually what they were looking at was the effects of the damage of that, not the effects of age. And when we look at healthy horses, and we've done a couple, both healthy horses and healthy ponies of around 20 years plus, and we feed them enough forage, so at least that 1.5–2% of their body mass dry matter, we actually find no differences at all from an adult. So we find the same for protein, for energy, for vitamins, for minerals. It might be we've got one study that suggests perhaps if we don't feed enough forage, they might show a reduction, and we need to do some more work there. But these are healthy. And I think your question was really valid, Rowley. They're healthy animals. So, but I'll let Nikki answer, but that does not mean that I don't think we need to adapt our diet even for healthy older horses. But as far as do they have a major change? Now, when they get to very old, you know, there will be changes along the gut. That is in every species. There will be changes even in how their mucus production is in their gut. But in a healthy, active, older horse that's neither too fat or too thin, there's not that much difference.
You'll be delighted to know. Thank you, Pat. You're getting a real sort of lots of chat going. Anne goes, I know a 32-year-old thoroughbred. Rebecca says I have a Welsh Section A in her late 40s. Anna says our Lulu Donk lived to 48. And I loved it. Icelandic horses, it's not unusual for them to still be ridden into their late 20s or 30s. And then Alex says, let's hear it for the Welsh Section D. Mine is 29 this year and still hacking and doing charity rides. I hope, Alex, that's for World Horse Welfare and for Red Wings. And if not, it should be. Nikki, what is your take in terms of what changes start to occur, you know, in that older horse?
Well, I think one of the things that we noticed is definitely, it's, as Pat's already said, there may not be that many changes about their requirements, certainly not at the ages of the 15s and 20s, but once they get to round about the 15s, 20s, 25s, that's when you really notice huge changes in their dentition. So obviously, as all horse owners are aware, horses have these, are born with these wonderful hypsodont teeth that they're implanted deep into their mandibles and high up into their skulls. And during the course of their life, they're ground away at the occlusal surface where they meet, grinding down the hay, breaking it down into pieces that are easy to digest. Now, when they start to get to later life, you start to get dental problems. So first of all, they start to run out of reserve crown. So it may be that they start to become a little bit loose. And that may make it uncomfortable for them to eat. They may start to lose teeth completely. Very importantly, gaps can form between the teeth, because as they descend, their sort of cross-sectional sort of profile narrows. So these little gaps can form between the molars, and food can get stuck in there and become very sore, very painful. And they can actually get periodontal disease, the same as humans can. Now, before we go to bed, we can floss our teeth and we can, gargle with our Corsadol. Other brands are available, and we can do all of that. But the horse can't. So if food gets stuck between the teeth, it is going to cause infection and even loosen the teeth further. And then finally, after all of those years of grinding hay down, the enamel surfaces that they need for the grinding process, they finally wear out, and you get horses that become smooth mouthed, is the term we often use. So they've still got some teeth, but when they're fed forage, they really struggle with it. And I think there is quite a sort of perception that when horses eat forage, obviously they chew it, they swallow it, but there must be other processes breaking down the length of the fiber particles as it passes through the gut. But no, pretty much the teeth do all the work. So if the teeth are starting to fail, they're not going to break down the hay into small enough pieces. And you very often find a lot of these older horses, even before they start to quid, so it's rather more obvious they've got a problem, you often find that their droppings will change. So very often you find much longer fiber particles in the droppings, and sometimes you'll find they've got totally normal droppings, but they pull through excess water, which you often see down the back legs. And I always joke and say it's like a little bit of a gravy, a little bit of a jus that comes with the droppings. And all of these are really, really little subtle signs way before the horse starts to quid that it is really worth getting those teeth checked. So I think the importance of dental healthcare for the older horse, many of these very often are much better off on 6 monthly checks once they start to have problems with their teeth. But it's so valuable because it can really direct your feeding.
And, so minimum of annual checks up until that time, and then you recommend.
So and always, I know that everyone's got preferred people to do the teeth, but do make sure that your equine dentist is fully qualified and is happy to work on the horse. Do make sure that whether or not you've got a fully qualified equine dentist or your veterinary surgeon's doing it, that that horse is used to having a nice full gag place, because that's the only way people are going to be able to see right to the back and spot these problems. And and if your horse needs sedating to make that happen, because again, sometimes these older horses, they can have quite painful mouths. So in order to best treat them, it might be the horse will need sedating for it, or even subtle things like it's not that common, but osteoarthritis of the sort of jaw joint, those sorts of things. And also Very often, if their incisors are diseased in any way, there's a couple of diseases we often think of, or loose or very short. You know, it's about careful placement of the gag, and it might need padding. So yeah, there's lots of things you can look out for, but it's seeing those subtle signs of dental disease that might happen way before the horse starts quidding. You know, the horse may pocket feed in its cheeks, or you may see some extra sort of extra drooling, or it may be the horse used to eat its feed in 5 minutes and now it's taking 15 minutes. So it's
those signs. Pat, just very briefly, I mean, we just heard from Nikki there the importance of teeth. You have a horse that has no teeth. How do you manage that?
Well, she has incisors. So I manage it by, I work closely with a veterinary surgeon who comes regularly, and we keep an eye on it. So she lost most of her molars by 15 years ago. She still, I think, has probably one. But that means she can't include anything. So how do we manage it? Is it was a gradual change. So as she lost the teeth and the ability, the first thing that I had to do was to change from her normal food, because she couldn't eat hay. So I had to feed, initially it was a chopped hay with her feed in a big mash. And you do need to change all kinds of things, because you've got to feed them separately from other animals, because they will eat her food, because it's very tasty what she's feeding. And you have to give her time to eat it, and it's quite messy. And I've got some pictures that I might be able to show how initially you've got to, I fed her on a big sheet in the field and kept the others away, and it was a mixture of soaked feed and chaff. Then you've got to go to the point where she can't do that. Was slide 9. Yes, there you are. Thank you. That was Cherie at her first stage. And there you can see her when she could eat a soaked feed, but she would mess. And the thing is, they're quite messy. And then if you can go to her at slide 11, actually, this is her this year, and she's between 35 and 40. She just clipped, because she does also probably have PPID. But here she's having to be fed on a raised, because as Nikki was saying, because of her, we want to make sure she's fine. But here I'm having to put her in a separate area, and she has to have time to eat this feed. And she's now on a soaked mash, which is a pure feed of a mixture, really high quality protein. Because although I said there's no need, they don't have a change, I think there is a need for improved quality and quantity in these older horses of their protein. I also think you need to do things like in vitamins and minerals. You need to make sure, I always go to the one level up. So she's not in work, but I feed her as if she was in light to moderate work. And I have to feed her now. She is lucky. And if you can go, actually, I'm going to just do something slightly strange. I'm just going to show you this background. And I don't know whether you can see my background here has changed. But if you can look at the background here, these are the quids that she does on grass. So the advantage that I have with her is she can go out onto grass, and she is capable of eating the grass, but she can't swallow it, but she will just open her mouth and drop it. Now, that means that she is constantly, when she's out at night, I'm able to let her out, because then she's able to do it, and she lives a life like a horse. During the day, she has to come in, and I have to feed her multiple meals of her nutrients in time to allow her stomach to manage. So you have to feed her meal. She has to have 3 or 4 hours for it to pass through before you can feed again. And I give her 3 big meals a day. And she's lived like this now for 15 years. And as you can see, for an age, she's in great condition. The only thing I would say about the quids, for any of you that have ponies, you need to be watching your horse, because I have a pony with a grazing muzzle, and the pony hoovers up those quids, just puts the grazing muzzle over the quid and sucks them up. So if you don't realize your horse is quidding, and I think this is the one thing Nikki and I would say, keep an eye on your horse. Things happen rapidly, but they can sometimes happen slowly, and you just don't notice it. So that is a real thing. I'll go back to the other thing.
Brilliant.
Lot more we can talk about that if people want to know how you introduce it, but that's
Brilliant. Well, and that's a good prompt for Q&As. And so thank you. Some of you started giving us some question and answers. I'm going to get told off because we're not making enough progress, I don't think, in terms of the questions that we've got here. So but we have started to pick up, and I thought it was very interesting, Pat, that you're talking about the importance of allowing her to express normal behavior. Although actually nutritionally she's not getting any benefit, but actually she is able to express normal behavior, and I know we'll come back to that. Nikki, then let's just think about the specific health conditions that we need to think about from a nutritional management point of view in the older horse. What are the key ones? And I know Pat's mentioned a couple already.
Actually, one's going to seem a little bit strange, but is so worthy of mention. So it goes along initially with the whole how you feed the older horse, rather than, as Pat was saying, there may not be that many changes with what you feed the older horse until they get to the stage where they're very challenged from a dental point of view, and you need to look at adjust how you feed fiber. But osteoarthritis is really something that is you need to be very aware of in the horse. So as they age, when they're out grazing and a horse wants to lower its head to graze, and very often we feed from the floor, don't we? The center of gravity of a horse when it's standing normally with its head up is behind the withers. Yeah. But if they put their head down to graze, it actually moves forward, so it's much more centered over the horse's front legs. Because if anyone's ever been bashed by a horse swinging its head, you'll know it's a very heavy item, the head. So it does actually move the center of gravity forward when a horse lowers its head. And I don't know if I could actually just trouble you for the slide. I've got a horse there with osteoarthritis labelled on the slide. Oh, thank you so much. Thank you. So this is a horse. He's an adorable horse called Troy. Sadly, he is no longer with us, but we worked incredibly hard to make his late senior years really happy and healthy. And as you can see, we managed to get a super body condition score on him, considering he was over 30. So I've just circled a couple of the key points to think about with osteoarthritis. So I mentioned that it is possible to get osteoarthritis of the temporomandibular joint, the jaw. But I don't see many cases of it, but it is something to be aware of. But you can see in the picture where the horse has got the head lowered, how much weight would shift forward over those front limbs. So if in actual fact you've got arthritis of those knee joints, the fetlock joints, if you've got any discomfort in the feet, that's going to put the horse off wanting to lower its head. Yeah. Also, look at the flexion in the neck. And when you think again about a horse grazing, we're so used to seeing that easy flicking action of the head where they grasp and they tear, grasp and they tear. Again, very similar when a horse has a hay net. So we hang a hay net and we see the horse take a mouthful of feed, and then it does quite a rapid swing of the head to the side, doesn't it, to pull hay from the net. And imagine you've got osteoarthritis in any of the joints of the neck. And again, considering arthritis in the hind legs, well, that's maybe not going to be affected when you're doing things like pulling hay from a net or grazing. But part of the thing you do when you graze is you ambulate around the field. So it does become relevant, perhaps if the field is quite poached, which we're all struggling with this time of year, or perhaps you're grazing on an incline, or there's a very long distance maybe between where the feeding stations are on a field and perhaps the water stations. So it's again thinking about these older horses, identifying that any source of chronic pain in the horse can impact on its desire to eat, but also it may affect their physical ability to eat. Yeah. And I think we've got a couple of slides that may show it a little better. If I could trouble you, I think there you go. Thank you so much. Just showing. I think it's easy to forget just how much of a sort of swinging head action horses use to tear hay from a net. And then also, I think we've got another slide to follow, please. Yeah, just showing some really low cost options to make it a lot more comfortable for a horse. So just simply there's just a gate bracket with a bucket in, and this is one we use a lot of time at Red Wings. It's got nothing to do with my love of Formula One. I'm not stealing car tyres, you know, just to get close to cars. But if you've got any old car tyres, they're brilliant, cheap and cheerful, to just raise things up a little bit. And you don't have to have a hay net. You can just reuse water buckets, etc. So, and I know that I spotted that absolutely beautiful raised feeding station that Pat uses for her horse.
Yeah, brilliant. Thank you. God, so much in there. Pat, from your perspective, what specific health conditions should people be looking out for in that older horse?
Well, I think there's a couple of things just to quickly say. When we're talking about older horses, there's little things like their immune system. We all know about immune system now with COVID and everything, but as we age, our immune system, same as humans, same as horses, their immune system becomes less effective. And they actually develop a condition called immunosenescence. They also have conditions where they get a condition called immuno aging. They get a reduction in their immunology, inflammaging. And the problem with that is that is worse if they're obese. So as we get older, we get that inflammaging, and that inflammaging becomes worse with obesity. And that leads me to a really important point about older horses. Older horses can be fat and obese, or they can be thin or normal. And it's not necessarily normal for an older horse to be thin. You need to think, if your horse is thin, there may be an underlying reason for its thin. Teeth, obviously, but it might be another problem they have is as they get older, they become less able to manage their thermoregulation, i.e. they are more difficult when it gets hot, but it's also more difficult when it gets cold. So a horse you've had that's always been able to maintain its weight over the winter suddenly may not, and it may have nothing wrong with it other than it is less able and it needs more calories. So I would say too, one of the big things for me is to monitor body condition, because things happen rapidly in some cases, but other times they happen gradually and you might not notice it. So my big thing is monitoring, and monitoring for things like take the rugs off over the winter. You cannot judge a horse. You need to take those rugs off. I know it's not been suitable weather, I can tell you, but take the rugs off, feel your horses, especially, you know, ponies get long coats. That hides things. You need to feel these animals. So when we say with aging, you've got to think things like body condition. You've got to think about teeth. You've got to think about the fact that they are less able to manage their temperature. They're less able to fight infections. Another thing they may be, it's a little bit of evidence that they may be less good at managing worms. So they may get more resistant or have more problems. So you need to think of your targeting worming plan needs to be adapted to the age of the animal. So you can't use the same in a younger, or you shouldn't be. Same as your teeth, you need to up your thoughts about how do we check, what do we do, how do we manage it. So I think these are a lot of things. Sorry, we're throwing a lot of information to everybody, but it's really important to monitor and to remember. The final thing to mention is insulin resistance. I cannot not talk without talking about insulin dysregulation, and then I'll let Nikki talk about PPID. But as with all mammals and humans, as we age, we will become more insulin dysregulating. So that means that even animals that are normally, you know, healthy, not insulin, they're not a pony, they're not high risk of insulin dysregulation. As they get older, they may start having insulin dysregulation. When exactly they show that is going to be individual again, so you have to monitor. And it becomes important, in particular, if they are a pony, because that might increase the risk of laminitis. If they're developing PPID, that might also doubly risk their risk of laminitis. So when you're talking about with your vet, you need to check about the teeth, the worming program, but also think about potentially monitoring for insulin dysregulation. And that makes a difference to how we might feed our older horses. And we can pick that up a bit later, but those are some of the conditions that I just wanted to mention. But maybe Nikki, you could pick up PPID, because that's a big one that I'm sure people.
That would be great, Nikki. I mean, how, PPID, we talk a lot about it. How can people recognize that or know their horses at risk of it?
Oh, that is such a good question. It used to be that we would just always say to people, oh gosh, when they get to a certain age. But I know that probably all of us have come across ponies that actually aren't that old. And it's, but the concerns of PPID have been raised. So yeah, it isn't just something that they wait till they're 20 or to have. It can be quite a lot younger than that. So over signs that they might have PPID, to be honest with you, it starts really subtly. So they don't just suddenly, 1 year they're fine, then next year they've got signs of PPID. So it's really, really subtle. So you may find ordinarily they would start to shed their winter coat in, say, March, April time. And then maybe the following year they don't start to shed the coat till, it might be sort of May time. And then the following, and then you may find it certain parts of the coat they retain. So areas I often notice on is the long hairs behind the elbow. They often hold the hair there. That's an early sign. Also whiskers coming down from the side of the jawbone, they tend to hold it there. So there's certain little areas where you notice these long graceful hairs are starting to appear, particularly if it's a breed where you wouldn't expect it. I often find it's a little bit harder in some of our hairy comps because they're pretty hairy most of the time, but it's a lot easier in some of the Welshes and the thoroughbreds to start to see these longer hair. You may find as well that there's change in muscle cover. So very often things like there may be a slight sagging of the back, or there might be more of a dimple above the eye, or perhaps their belly is a little bit hanging a little lower, even though their weight on a weighbridge may be exactly the same. And then you may suddenly find that your water bucket that you fill up the night before and has always seen the horse through the night, you may find they're getting through a lot more water. And as a consequence, you may come in the morning to muck the horse out, and urine is sort of dribbling out from the bedding, because definitely they start to drink a lot more. They start to urinate a lot more as the case becomes advanced. They tend to be much more vulnerable to infections, particularly respiratory infections. So if you notice, quite often your horse is getting evidence of nasal discharge, like a sinusitis, that could be a key. It was really super interesting. Also, Pat mentioned about being more vulnerable to worms, and I'm sure we're all familiar with Para-Ascaris roundworm, which we all think of a very young horse disease, and tends to be, horses sort of under the age of 2, and then hopefully they sort themselves out and they grow out of that sort of behavior. Well, I've noticed at Red Wings, some of my much older horses, particularly if they've got PPID, I start to see in their worm accounts, we've got a few Para-Ascaris eggs come back, and it's so I don't know if the same as in old people, immunity is affected, but as Pat says, if that's going to happen anyway with aging, if they've then got PPID as well as, then I think it can make them quite vulnerable to things like worms. And then
Nikki, Pauline's just asked, what is, sorry, I should have introduced it. What is PPID?
Okay, so PPID is the more formal name for Cushing's disease. So I think more people would be familiar with that terminology, and the PPID just is referring to dysfunction of a particular part of the pituitary glands, which is the pars intermedia, hence the PPID. But yeah, it's basically Cushing's. So
Brilliant.
and and I think with so many diseases, the terminology changes, doesn't it? And I for one, I empathise because I struggle to keep up. So yeah, so those are some of the sort of changes you will see. But as Pat rightly mentioned, some of these horses do seem particularly prone to laminitis, and in actual fact a lot of studies that have been done show that quite a large percentage of horses with PPID are also insulin dysregulated. So again, it's a case of not only finding out whether or not the horse has, pituitary dysfunction, but is it insulin dysregulated? So yeah, these horses need a lot of extra special care. But the good news being is you can manage them very successfully for a very long time.
Clearly what's coming through is, that the veterinary intervention and a veterinary engagement in the older horse becomes ever more important. Clearly it's important the whole way through, but that, because obviously a lot of the stuff what we're talking about, it's going to be difficult for owners to have a thorough understanding of it all. But that's why that engagement with the vet is so important, which I know we'll come back to. We've got a pile of questions piling up, so we'll kick on. Pat, there's quite a lot of talk about soaking of hay and soaking of feed. So let's think about the specific feeding recommendations for the older horse. What would you recommend for the healthy, active, or even overweight healthy older horse?
Yes, good to start there, because I think we should start that a lot of our horses, as everyone's saying, are healthy, active, and to be honest, the majority of them can manage on a similar diet to the adult horse. What I would be saying is that you want to make sure you really are keeping up to date. You're making sure they're well fortified. So if they're on a forage or a pasture, you really do need a balancer, because you need to make sure you're supporting them for all their vitamins and minerals and the protein quality, because muscle loss is a problem as you age. Sarcopenia is the name of it, but we don't have specific information, but there's a lot of anecdotal and evidence to suggest that if we can keep that quality of the protein whilst we keep them as much exercise as we can help support the muscle. And just one thing I wanted to say, Roly, absolutely agree that veterinary monitoring, but I think it's really important that owners can do a lot themselves. As Nikki said, we can look at the feces, we can look at the urine, we can also do body condition scoring for losing weight, gaining weight. But we've developed a pilot, it's the start of a muscle scoring system for owners, and we've just published it and trying to get people to see if it will help people to monitor their horse's muscles, so that you yourself can say to you're keeping a check and can tell your vet, I think this has changed. Just these subtle challenges. So going back to your normal horse. So I would say that what you need to do in that healthy, active horse, you need to think if you're on a weight loss diet, you need to put them on restricted calories, try and increase exercise if possible, taking into account. You need to make sure you keep the quality of the protein, the vitamins and minerals. And you just want to feed a low restricted non-structural carbohydrate, because as they're getting older, we're saying they may change. So the same as now that we recommend for all horses, we want to keep that starch level down in the meal to a reasonable level in your healthy active. And then if they're lean, and I saw there was one question, the things that you can do if you've got a lean horse is to change your forage to one that's less mature, that is more nutritious. But first of all, check. So I think if they aren't holding their calories, you do want to do the thing, get the teeth checked, make sure your targeted worming program is correct, all of that. Think about your forage. Can we change the forage? You can think about going up and using oil. A lot of older horses can use an oil supplemented fortified feed, or you can add in oil. But as long as you add in gradually, you check. Some older horses are not as tolerant, but you can check that by again looking at the feces. Add slowly, gradually, check the feces. Know what your horse's feces, they change during the year normally. So it's really understanding your horse. So that is my active. And then you're right, the lean, the thin. But if they're lean, and I'll let Nikki talk as well, but the lean animal, start by checking, are they being bullied? Just check that, are they actually being chased away from the hay in the field? Because as they get older, there are a lot of things that happen in the dynamics in the field. And I know Nikki can talk a lot about this, but also, can they get to the feeder because of this arthritis? So again, with these older horses, it's really looking at them and just checking that, talk to get your vet in as well, but just check that there aren't some very simple things that might be affecting.
Yeah.
So yeah, I could go on for days, but I know we've got
well, we can't because we've got a heap of questions coming in already. Just before I come up to Nikki, we've talked about body condition scoring, and Basil, maybe you could put up a link to so people who want to know more about how to body condition score that we could do that. Nikki, obviously, Pat's talked. She was starting to encroach, I thought, into it, but we talked initially about the healthy active. What about the underweight older horse in terms of specific feeding recommendations for them in your experience, obviously at Red Wings?
Oh, it's such a good question, and to be fair, there's no person finer to answer it than Pat. But so at Red Wings, what's quite interesting is we do divide off our groups into what we cheerfully call pre-no long fibre and no long fibre. So one of the key things, and I know I keep coming back to teeth, but they are just so crucial to your decision making and how you go ahead and feed the horse. So what we tend to find is you'll have horses that, because they're losing that ability to properly chew the hay and get the most out of it, we obviously thoroughly check them over to make sure there isn't another cause. And but if we determine from the dental charts that in actual fact they may be struggling, and again it's about looking at how they cope on the field. I mean, it sounds crazy, but literally 20 minutes stood with a cup of coffee watching your horse out and about on its field is time well spent. And I don't just mean because coffee is wonderful. I actually mean your horse could be quidding occasionally, but its friend on the field eats the quid, so you never get to know that it's quidding occasionally. That sort of thing. It's that opportunity. You see the horse pass the droppings, and there it comes. There's the jus afterwards. It's seeing that other horses are pushing it out of the hay ring, out of the feeder, that it never gets to go in the shelter because it's fallen down the pecking order. So it used to go in the shelter, but now the younger horses on the field won't let it in. So it's time well spent. Is, as Pat said, it's knowing your horse, and it's just standing there and watching it on the paddock. So, but if we get a horse whereby we know actually one of the major problems is the teeth, we will try initially just giving the fibre in a different form. So we wouldn't straight away go to giving sort of conditioning mixes and cubes and that sort of thing. Now that's quite tempting to do. If you get an older horse that loses condition, we tend to automatically towards very conditioning foods. When in actual fact, if the teeth are a problem, you can still stay with this lovely fibre-based diet, which is after all what the bacteria in the hindgut are craving. They want fibre. The horse was designed for fibre. So so we would first of all check if we give the fibre in a different format. In actual fact, are we going to get the weight gain that we're looking for? And I would say 9 times out of 10, you get it. You get the weight gain you're looking for. So those would be what we describe as our pre-no long fibre groups. So they have full access to forage, full access to pasture, but a couple of times a day, they will have fibre presented in a lovely, easy to eat format. And one of our preferences is for like a high fibre pellet. And again, if their teeth are good enough, we will offer that to them dry, assuming it's one that hasn't got to be soaked, obviously, but very often we feed them dry because we want them to be chewing. We want them to extend their eating time and have lots of things to do. And then as their teeth decline further, we've got the option then of soaking that. And then also there are many high fibre mashes on the market, and some of them are quite wonderful and fully balanced for vitamins and minerals. So we've got options there, but they're still allowed the access to forage. If we get to the stage where they've been presented for impaction colics or a choke, then that's starting to tell us that them having access to forage could really compromise their well-being, because horses love to chew, they love to be out with their friends, so we don't unnecessarily make them totally no long fibre. But if they get to the stage where they're getting impaction colics, then that's telling us there is a genuine problem. So then they would move to a no long fibre group where we provide absolutely 100% of their daily ration in multiple meals, but again, we're fibre all the way, as much fibre as we can get in, and we will either do that in a high fibre cube, which is soaked or dry, or one of the mashes. So we can sort of cater for all levels. I don't know whether or not I can be cheeky and ask you guys, there is a slide of teeth.
You can have one slide, because we're going to have to change the rules of the game in a second, but you can have one slide. Go on, Basil. Give us the teeth slide.
Teeth slide.
I like it, working Basil hard tonight. That's good.
I love it. Thank you very much, Basil. That's lovely. So if you can imagine that when a horse's lips are closed and when we can't see, these are some of the fun things that you don't get to see. So the sort of top middle picture there, that's a dental caries, which is basically extreme tooth decay. And you can imagine how painful that's going to be by the time it erodes through towards the nerves. Then on your left, on the right hand side, I apologize, at the top, we've got an example of a diastema, these gaps that form. And if you can see, there's some really deep erosions in the gum. If you look just up above the mirror, you can see some really deep erosion. That's it. Yep, you've got them. And what's happening there is long fibre is getting jammed acrossways in that gap, and the ends are sticking out. So every time the horse chews, it's scraping up and down the cheeks. And there's no way you would know that without putting in the mirror and having a look. And then on your bottom left, you've got teeth that are so worn away that they're completely starting to cup out. There's no enamel surfaces there. And then finally, with our last slide, you can see enormous erosions both on the left and right of the tongue in that picture. That's it. Can you see those bright pink erosions both on the left, and there's a horrible one on the right, and that's caused just by some sharp points at the teeth at the back. So these are all things that a horse will appear completely normal, but might start to lose weight. So hopefully it's quite a good sort of pictorial. Thank you.
That's great. Listen, thank you, Nikki. Now, the rules of the game have got to change a bit now, because we've got so many questions to get through. You can't really do yes or no to these answers, but we're going to have to keep the answers really tight. Nikki, I'll just stick with you first. End of life, we're talking about the older horse, and obviously people have got to think, and we do, and I'm sure at Red Wings as well, but at World Horse Welfare, people find it really difficult, completely understand the decision about the elder horse. What's your advice to an owner who may be unsure whether it's the right time to put their horse to sleep?
Well, firstly, I feel for anyone in that situation. It's no different to when you have to consider, your family dog. Just horrible situation. So my top advice would be, in an ideal world, it sounds awful, start to consider your horse's welfare before you get to the stage of needing to consider whether or not it's end of life. If you can keep good records of how your horse is now, when they're happy and active, and what they do and what they like to do and what is normal for that horse to do, you'll find it a lot easier to compare and contrast when in latter years that horse is seems to struggle to ambulate around a field, is no longer interacting with field mates.
Yeah.
Perhaps the facial expression has changed. There's a lot of research into things like grimace scores and how a horse can express pain with just a facial expression. So I would say one of the easiest things to do is to start early. So have a look at how your horse is now while it's in a good place, and that's going to make it easier to judge. If it's the case of the horse is already at the stage where you're having to contemplate it, you do need to phone a friend. You do need other people that know the horse and maybe don't see it every day. You need a trusted friend and someone to talk to.
Yeah.
Finally, your vet would also be a really good person. And I know that there are several charities and organisations that have really good online references that you can look at and good suggestions for how you can approach making that decision. Obviously, there's also Friends at the End, which is done via the BHS. I believe, correct me if I'm wrong,
Yeah, you're
Rory.
dead. Yeah, absolutely.
Yeah.
Yes.
And they can even put you in touch with someone in your local area if you've made that decision and need help with the actual process. So
Brilliant.
lots of resources out
Yes.
there, but don't do it on your own is my advice.
Thank you, Nikki. And Basil, maybe you could put the just in case link there, which is the World Horse Welfare. But as Nikki said, BHS and the Blue Cross and others have some really good advice. Pat, what advice would you give someone looking to sell an older horse?
I think you need to make that very important decision. Is it right for the horse to be sold? Sometimes it's a very tricky decision for all of us. And I've got a really old horse. All my horses I look after now are over 25. So, you are coming to those kind of decisions. So I think it is a bit like making the decision, is this the right thing for the horse? Is it going to have a good home? Sometimes you actually may need to make a quality of life or the right decision at that moment, which is very tough. If it is going to go and you're going to sell it, you need to make sure what are the issues, and the people who buy it, I think, are they able to cope with that? And as the horse ages. So I would genuinely say very quickly, I've managed my horses, say 15 years, I feed her, but it takes 3 to 4 hours a day that we have to allow for her to eat her food. And that means you have to be committed to that. You've got to separate her. You've got to know that you can manage these older horses. And there's nothing wrong with saying you can't and that it's the right time for them, because actually it is difficult. And I would really like with Nikki, watching that some of them you really need to know that they're able to. So going back to your question, I think you need to really think hard. Are they going to go and are they going to have the right care, the right family? Or are you passing on an issue because it's difficult to make the decision? So I think that's a very difficult question because every scenario is different. But I would ask people, and I think Nikki's point of talking to your vet, having the vet that when they come and do a routine check, that they know your horse, they know what you're doing, and having some friends you trust to give you can have an honest discussion.
Yeah.
But
so often we say you assume you're not going to do that and then convince yourself it's a good idea, as opposed to the other way around, and you'll generally sort of stress test it. Okay, listen, we imagine we're in the foothills of the Everest. We've got a big mountain to climb because there's a lot of questions. So I'm going to come to each of you, jump in if I don't ask you the particular question, Nikki and Pat. But Nikki, coming to you first, what are some of the nutritional strategies to manage arthritis and promote joint health in senior horses?
The honest answer is there are a lot of joint supplements available on the market. However, at the moment, the most recent review, which was only published in an excellent book in 2021, is that we cannot draw a conclusion on whether or not they are effective. So it's clear that we need further research on them. So I would certainly say to anybody that, you know, I'm not saying don't try them if you want to try them, or if you find they're effective for your horse, that's wonderful. But I would very much start, if you've got an older horse with osteoarthritis, I would very much start with the basics. Make sure that your basic ration is very perfectly nutritionally balanced, so there are no areas where you're lacking. I would definitely look at obesity. Make sure that horse is not overweight, because that's going to increase weight loading through the limbs. And it's been shown that fat can also cause a higher incidence of sort of chronic degenerative diseases like osteoarthritis. I would make sure that you spend money on a really good farrier, because obviously we all know a good farrier is worth their weight in gold. You know, they're going to make sure the weight loading and mediolateral foot balance is excellent. Talk to your vet. There may be some very simple things you can do. So I would work through that first as my checklist. And then if I got to the end and wanted to try something else, then that's fine.
So do the basics. Absolutely. Thank you, Nikki. Pat, Jane's asked, you've talked about elevating buckets at feed time. What's the best height if you do it? Knee height, shoulder height?
It partly depends if they have got arthritis or not, and whether how far they could put the head down. But I think it's also making sure whether they are the animals that will want to get their foot up. So it's actually trying to get it to that balancing act. Now, having said that, we are actually doing some work at the moment to look at what are the right angles to get the best positioning for things like hay nets to allow the horse, and how we want to do it. But a lot of them, if they can eat down, you are better, because actually their jaw works better to be having their head on the ground. The teeth are better designed. But once they can't do that, or they spill food too much, or they put the foot in it, you have to go up. And to be honest, I find it's probably about chest height. Seems to work the best. The horse likes it. The head's in a good position. If you look at both Nikki and my pictures, the majority of the pictures are at that height, because that's when we find it works.
Excellent. Thank you, Pat. Nikki, Jill's asked, what are the signs that lowering the head is painful?
That's actual fact. What you could try is the carrot test. I say that carefully, because obviously if they've not got very good teeth, don't want to give them choke. But if a vet was trying to look at a horse to see whether or not the neck was painful, we would probably use something really simple like a carrot test. So basically that you just hold the horse on quite a loose lead rein. You ideally get it so that it doesn't move its front legs, and then you just use the carrot or whatever treat, and you just see, can you flex? They should be able to go all the way around, touch their nose on their shoulders, either side, and look up, look down, those sorts of things. So they're all quite good indicators. And you may find, for example, you've got reduced movement to one side. And then at that stage, I mean, it's not guaranteed that it's osteoarthritis. There's other things. It could be a muscular problem. It might just have had a vaccine the day before or something. So it doesn't guarantee it's osteoarthritis, but it might alert you to it.
Brilliant.
Could I just add to that?
Go for it.
You want to just watch them in the field, because if every other horse is grazing and you've watched them for 20 minutes and they're not putting their head down, or they're trying to put their head down and they can't, or they're really splaying their legs. So again, it goes back to watching.
Absolutely, that 20 minutes. Although I did hear Nikki talked about her having a cup of coffee in the field. As far as I'm aware, she just drinks Red Bull, I think. I can imagine.
True.
I can imagine the Labradors are very good at the carrot test, because they would follow it. Now, Pat, question from Facebook: how might we notice early signs of vision loss in older horses?
Well, that's again interesting, because I think we don't know a lot about it, of whether they're going to lose acuity or they actually are losing how far they can see. So again, I would say it's watching the horse. If they are finding it difficult or they come up close to somewhere and it shocks them. So again, it's all monitoring. I'm not sure that I can answer that question of what more you can do for doing that. I think it's obvious when it's obvious. It's that subtle changes. And again, watching your horse, they do start to look, but it's more watching that they suddenly start missing the corner or they're starting to get too close, and you just, again, it's back to monitoring.
Yeah.
But I think that's again with the vets, if you're at all concerned, you need someone to look at, because I don't think the carrot test is quite good watching them. But vision is a difficult one because some horses will react if you do that, some horses don't. But Nikki, I don't know if you can add, because I can't add much to that.
I'm in full agreement with you, Pat. I suppose the only thing that I would add, obviously many people may be familiar that Red Wings had until recently beautiful Boo, who had no vision at all.
Yeah.
And it was quite interesting that if he was in an environment he knew, you would not know he
Absolutely.
couldn't see.
Yeah.
So in actual fact, if they've got gradually deteriorating vision, but are never asked to do anything outside of zones they know, you may not know what their vision is like until they're put in an unusual situation.
Yeah.
And
Yeah,
then, of course, oh, sorry, Pat.
No, I was just saying that I would find when I put my old girl with a new fence line, I notice she's not as good because she's definitely starting to lose the vision. So it's the new area that you monitor.
Absolutely. Brilliant. Question from Tracy. She's asked, my horse is nearly 15, hunted for 9 years, now trying a bit of dressage. I'm worried about arthritis. What are the signs you can spot before they start? Nikki, maybe I'll come to you on that one.
Obviously, it will depend where the arthritis is. But if, for example, if it was in the limb, some of the earliest possible signs is you might discover that you've got a little bit of joint effusion, very low grade. But it's usually that you start to get an effect of the range of motion in a particular joint. And so it might be something really subtle, like horses ordinarily really well behave for the farrier. And all of a sudden he starts to get a little bit jiffly for the farrier. And it might be because he's got one leg flexed right up for a period of time, and or he doesn't want to weight bear on a particular leg for a period of time. Or you may find after the leg is put down, he's a little bit tentative on it. So those might be some of the subtle signs. Also, and it would depend on the circumstances. I would say it's a bit more visual by this stage, but sometimes you get things like just subtle squaring off of the toes behind when you get early signs of like hock osteoarthritis, just that subtle squaring off of the toes. Again, your farrier might even point it out to you, and that sort of thing. But obviously, as it progresses, or if it's bilateral, if it's perfectly symmetrical, it can be quite hard to see when the horse is just trotted up. So yeah, you might have to look for more subtle signs.
And you mentioned earlier about the things like the Grimace scale, and there's research around sort of the behavioural the ethograms that horses, you know, the swishing of the tail and going above the vertical and that intense stare. So there's quite a lot of new sort of stuff coming out that we can help us identify. So the horse will tell us it's in pain, especially if it's being ridden and doing dressage, which we can benefit from as well, can't we?
That's such a good point, Rowley. That's, you know, incredible work done by Sue Dyson and all of these ethograms. And like you say, the very subtle pulling back of the lips. It might be that there's an intense stare to the eye, almost like a frown. The ears are just fractionally back, and or the tail being held to one side. So those are really invaluable, and I think it'll move lameness diagnosis forward for everybody. And And
And
myself
what's
as a
come
vet,
through,
I'm very grateful.
yeah, no, absolutely. And what's come through several times now, it's so important that we know what the normal is for our horse, isn't it? Because actually expressing any of these behaviors may not be an issue at all, because they do, it may be normal for them, but actually it may be a flag that it's not. We could talk about that all night. Pat, nutritional strategies, what nutritional strategies can be used to prevent decline in immune function as horses age?
Well, the first thing is we're going to go back to basics. Certainly, I would say throughout our life, we need to make sure we get plenty of the basics. So the good forage, that's fine, but also the vitamins and minerals, and antioxidants, because they will protect our nerves, our immune system as far as we can. There's no magic bullet, but there are things we can do. So absolutely checking as we get older, and certainly if you're adding in oil, you need to think about vitamin E. But there is something that possibly, as the horses get older, is things like vitamin C. And both Nikki and I, and these older horses, when they have extra infections, we might give, it has to be quite bioavailable. Vitamin C might help some individuals. The only thing I would say is if you add it in, don't rapidly change your diet. You shouldn't change any horse's diet rapidly anyway, but you don't add in vitamin C for 3 months and then suddenly stop it. Because although they can make it themselves, they've then got used to it, and so you don't then rapidly stop it. So I would say, really, this is why I recommend in all older horses, we feed the vitamins and minerals and antioxidants, I include in that, one level above their exercise level.
Yeah.
And then when we get an older animal with PPID, with infection, we might consider thinking about making sure that we are adding a supplement or something that has some vitamin C in it. But vitamin E, vitamin C, basic, your vitamins and minerals.
Brilliant. Thank you. Sue is up. We've got so many questions. So what would be great, if you can upvote existing questions, we'll be able to get to them, because I think we might struggle to do all of them. Sue's asked, who could ever sell an older horse? Well, yeah, it's a really good question, Sue. And unfortunately, it happens all too often. But I think, people should really, the responsibility for selling a horse at any age is a significant one. But for sure, in our older horses, it gets more and more. Anne's asked, one for you, Nikki. What does good quality protein consist of?
I'm going to pass that straight over to Pat.
Okay. What it is that there are certain amino acids. So protein is made up of amino acids, and there are certain amino acids that, if we don't get enough in our diet, the rest of the amino acids are of no value, because basically we lose them, because we can't store them, we can't utilize them. So we need, when we talk about good quality, we mean that we need to give protein that provides adequate amount of those essential amino acids. So in particular in the horse, we think it's lysine, but it's probably also threonine, and there may be some others. So when we talk about quality protein, we're talking about the amino acids quality. And so that's why we suggest, so for example, forage in the UK, even if it has enough protein, usually a grass hay in the UK does not have enough of these quality amino acids. So this is why we suggest, even if you're on a forage base, that horses should be, we love forage, Nikki and I, forage is the foundation. But that's why a balancer, because the balancer provides those quality amino acids. And that's what we're talking about.
Brilliant. Good pass there, Nikki. I like that. Good technique. Jenny has asked a question, and she's from a charity we know well, Legacy of Legends in France. And they have a number of horses that come to them that transition from retirement, having been an active horse sport or whatever. And she talks about, the importance of that transition, because that they can come really depressed if that transition is not done carefully. What advice would you give to Nikki and how best to do to Jenny, Nikki, and how best to do that?
Well, coming from the organisation Jenny comes from, I'm sure actually she's already very, very skilled with these horses. But for anyone else listening, I do find if they can minimize the change when the horse goes to the location, and it's thinking about all the variables, because if you move a horse, it's going to be in a new location. You can't do anything about that. But there might be elements that you can keep the same. So, for example, if we have a horse go to a guardian home and for any reason that horse needs to come back in, say for a procedure, then we often find that horse is quite depressed for the first 3 or 4 days. So often we phone the guardian and say, can you bring in some of its hay and some of its food, please? And even that will suddenly make the difference and get it to eat. There's nothing wrong with the food we're using, but it's just not the same as the horse has been used to. We also ask about how they feed it, sort of what height do they feed it? Do they use a net? You know, what size are the holes on the hay net? So finding out as much as you can about its previous lifestyle. Another thing is there's been several studies done that show when a horse moves to a new stable, new environment, it won't lie down and properly sleep that lovely deep REM sleep for something like 3 or 4 days. So we've got to bear in mind for the first 3 or 4 days, I'm trying to find the right term, the horse is going to be shattered, absolutely shattered, because it's probably not going to be sleeping the same. And also it is a horse that in the wild, a horse in the wild would be a prey animal. So again, it's got a lot to think about in this new environment. Is it safe? And I spoke to Nicholas earlier, Nicholas, who's our sort of senior head of welfare and behaviour at Red Wings, and we were discussing it, and he said there's this fabulous thing that a lot of the dogs charities use, which is the 3 days, 3 weeks, 3 months ethos, which is for when you take on a foster dog or cat. For the first 3 days, they're in shock in their new home. By the end of the first 3 weeks, they're starting to learn the routines, they're pushing the envelope, they're testing out, where the boundaries are. And by 3 months, they've worked out it is their forever home. Yeah. So it's about saying to people, look, you have to give these animals time, but also find out about how have they been trained. So I remember when I worked for a couple of years in Newmarket. I remember when I first went there, I went to do my good old correct pick up the feet to pick them out. I didn't know racehorses were trained so that you could pick up all 4 feet from one side. So they would expect you to reach under to pick up the other foot from the other side to pick it out. So there's me going round, and I had confused horses. So we've got to remember, if we don't know how that horse was trained, when it gets to its new home and we ask it to do something, it's not being painful with us. It literally doesn't know what we're asking it to do.
Brilliant. Now, the rules of the game change because we're only got about 10 minutes left. So you've got to keep the answers to a single sentence. Here we go. Pat, Angela's asked, what is the view on Presend for Cushing's? I've heard mixed views.
I think we probably should deal with that in a different question. That's a PPID, because I think it's not a nutrition one.
Right, yes, absolutely. Eva's asked us, Nikki, I have a 40-year-old pony. He recently lost a tooth, and while adjusting, lost a lot of weight. I have gradually introduced a balance to give him a boost, and he's always been fed haylage as he's allergic to hay. Any advice on feeding him in aid to get weight gain? One sentence.
Treat him as a no long fibre, so supplement his fibre intake with something like a high fibre pellet, which can be soaked, or a high fibre mash, and give him that boost to his other long fibre.
Love it. Thank you. Pat, Mandy's asked, I've just started my 28-year-old thoroughbred on a soach mash due to teeth loss, and I'm finding it hard to get my head around a bucket replacing a hay net. I worry if he's getting enough nutrients, although his behaviour says he is.
Well, great. What you will need to do is try and make sure that you're giving around 1.5 to 2% of body weight on a dry matter basis of that fibre meal. So you just need to calculate that. Small meal, well, it depends. If with my horse, I've had to train her. Sorry, this will be slightly longer. You do have to train them to eat a larger meal, is that because it's new, and mash, some of them takes a while to learn to eat a mash. But you might need to give multiple meals. If they can go out to grass or eat the long hay, just as Nikki's saying, that enables them to chew, enables them to have time for gastric ulcers, that they're still chewing, still having saliva. But if your horse is maintaining its weight, maintaining its energy, the horse is telling you you're probably doing a good job. If not, speak to your nutrition and your vet. But
Brilliant.
well done.
Thank you, Pat. Brilliant. Nikki, Sheila's asked, can you buy ready chopped haylage, or do people have a chopper to do it themselves? Have to have a chopper to do it themselves.
Certainly there are lots of chopped fibre products out there, and you can commercially buy them. I don't know that any have got chopped haylage in. Pat, I don't know if
That's looking like a no.
You're aware, because
Yeah.
obviously they've normally got chopped, you know, hay or chaff based sort of things. I don't know that haylage.
No, they wouldn't have haylage, because
keep.
haylage is preserved through the lack of oxygen. So once you open a bag of haylage or you cut it, it will go moldy effectively. Yeah. So you would never put chopped haylage into a product. You could, as long as once you open that product, you use it within a few days. Right. So it's unlikely. I'm not saying there isn't, because someone will tell me I'm wrong, but it's very unlikely that you'll have chopped haylage in a commercial feed.
Brilliant. Sticking with you, Pat, Linda's asked, I have a 30-year-old who's losing condition. Dentist says she has little teeth left, wormed early January. She is on a chopped haylage and senior mash, lives out with lots of grass and large field delta, which she uses ad lib. Anything else I can do to help weight gain?
Sorry, I'm just going to answer. Someone's just said that there is a haylage. Yes, if they're selling a chopped haylage as a product, but it's not a mixed mash product, it's not got all your vitamins and minerals and everything in, that's fine. Because again, once you open that bag, remember you've got to use it in a time period. So with the horse, again, if you're out and she's got in the grass, she's on a mash, make sure your vitamins and minerals are fine. If you're needing for the weight gain, again, I'm with Nikki, look at what the feed you're putting in your mash, because you might want to up the energy intake into that, or the amount you're feeding. What I wouldn't want you necessarily to be doing is adding more ones with a more cereals. So a lot of these older horses, because they're getting older, they might be ID. You don't want to add in cereals necessarily. So what you might want to do is look at your mash, seeing if you can get a mash that's a higher energy, but still very fiber, still restricted starch and sugar. And then you can add in oil. So you can add in oil. The thing sorry, I'm going to go over.
Well, no, as long as you tell us what type of oil you recommend, that's two questions.
Yes, someone's asked that. So what do I recommend? Vegetable oil, not animal oil, obviously. I think it can be things like, I typically would add either a fortified feed, or if I'm adding it in myself, would be corn oil, little bit of linseed oil. They're fine. Horses will have an individual palatability. Usually corn oil is more palatable, but general vegetable oil. Rice bran is great, is another way of adding it. You can add rice bran, just make sure it's stabilized and it's got balanced for calcium and phosphorus. Don't forget, if you're adding oil, it has usually no vitamins, minerals, and no vitamin E, so you have to add additional. Add oil gradually, and not all older horses will tolerate adding oil more than the adult. You have to do it gradually, you have to monitor them, and some of them don't like certain oils.
Yeah, brilliant. These are the longest sentences in the world, aren't they? Rebecca, but there's brilliant information. I'm taking the Mickey. Rebecca's asked Nikki, why do lots of veteran labeled foods, why are they high in starch and sugar, even though they're aimed at horses and ponies who are age risk of PPID and laminitis?
That's a really good question. So I think because very often senior horses are thought as struggling to hold weight, and there is still, as Pat said, there were early studies showing that they needed different amounts of various sort of, you know, proteins to hold weight. So I think they are very popular on the market, these sort of higher energy conditioning style mixes for senior horses. But the good news is there are plenty of high fiber senior horse products out there where you get really low levels of sugars and starches. So there'll be sort of 8% and unders, and some even as low as sort of 3% sugars. So there are plenty out there, but I do agree there are lots of high sugars on the market.
Brilliant. A question on Facebook, Pat. Just wondering why you choose a pellet over a chop for the pre-group. Oh no, that's for Nikki. Why do you choose a pellet over a chop for the pre-group?
Okay, so this is a little bit personal preference, so I apologize in advance, but because I've got a high interest in dentistry, for anyone that hadn't noticed, you know, I showed you earlier on the diagram, the photo of the horse with the diastemas. Well, short chop can get stuck beautifully in those diastemas because it's kind of cut to the right size. And so if I've been dentaling horses and I'm seeing major problems there, I have also known horses with poor dentition still manage to choke on the chop because they can shovel it in faster.
Yeah.
So it's a personal preference, but I would rather go straight to a high fiber cube, pellet or mash.
Brilliant. Thank you, Nikki. Question on Facebook, Pat. Is protein powder a good supplement to add to a horse's diet to build and maintain muscle?
Depends what's in your protein powder.
Right. Okay. Good answer. Then a question from Gillian. My elderly horse's poo is always quite loose, not diarrhea, but often more cowpat than round droppings. How loose is too loose, Gillian? Pat?
That's a difficult question. If your horse has, again, I'm going to probably pass a bit of this to Nikki. I think it really depends if your horse has always had that. There are horses at certain times of the year. So, for example, when the green grass comes through, quite a lot of horses will change their fecal composition for a few days as they change. If, however, your horse, and it's difficult without knowing what you're talking about, is always very, very loose, I think you do need to think about, I would get checked, just to check there's nothing wrong, look at the fecal, probably have a discussion with your vet, because it's very difficult for me on this to know what. So Nikki, I don't know if you can add to that.
No, 100% agree with that advice. So normally if it's the teeth, you will have completely normal droppings and they'll be accompanied by a gravy. So if these are actually quite cow patty, it sounds like it's a bit more of a gut upset of some description possibly, and also horses can ingest other things like sand can cause low-grade diarrhea problems, obviously parasites. I mean please forgive me, I'm not suggesting that the person asking the question hasn't considered all of these other things as well, but yeah, I think it is something that I'd be interested in getting a vet to have a look at.
And final question from Hannah, do older horses or horses with osteoarthritis need deeper bedding? Nikki?
Well, I'm probably a bit of a softie, but yes, I think that although, for instance, putting banks in a stable, I mean, they're not necessarily proven to reduce the chance of a horse getting cast, but I think if you've got a horse with osteoarthritis, there is an increased chance of that horse getting cast in a stable. So everything you can do to make it more comfortable. It depends. Some horses with osteoarthritis actually don't lie down very much because they're worried about getting up, but the majority do like a good snooze. So yes, I do like the bedding.
And Pat, how deep is Sherry's bedding?
Well, she's out. So she's out at grass and she gets up and down. She loves rolling. They love sleeping. And that's one of, going back on your quality of life, I watch her get up to know that I know she can get up easily, that she's fine. And so that's another thing to just keep an eye on. Rolly, just one other thing I would say to anyone who's feeding mash, please, I'm sure anyone who's doing it, but anyone's thinking of doing it, you need to keep it cold in the summer out of the heat, because it goes off and these horses will not eat if it starts to ferment. So you sometimes in real hot have to take them home or put them in a refrigerator. In the winter, please add warm water, because again, it's too cold. And again, the teeth, sometimes they don't like cold. So if you've got an animal old horse, I'm afraid it is a little bit of cotton wool, hot water, cold water, rugs on, rugs off.
Brilliant. Listen, thank you. And thank you to everyone for your questions. And I'm really sorry. I've worked them as hard as I can, but we can't get through them all. But thank you so much. Just do remember that this recording will be available later tonight on our YouTube channel. So do look out for it. Nikki and Pat, I'm going to come to you for final words. We've gone over so much and you've given us so much brilliant information. Nikki, come to you first. What would if you had to sum it up in another single sentence, what would your take-home message be?
Remember that the food you offer them, they may not be able to make full use of.
Oh, blimey, that really was a sentence. And that's brilliant. Thank you. And Pat, what would your take-home message building on that?
I think actually mine would be enjoy, monitor, and check. Yes, I think mine would be monitor and enjoy your older horse. You can give them a good life and it is possible to manage them, feed them well, but you might need to adjust for your individual. They're all individuals, but enjoy them.
I love that. Enjoy. What a positive way to end. So thank you to everyone for joining us tonight. Do remember, in a fortnight's time, we've got the horse about whether horses in stables can be happy, and we've got Professor Andrew McLean and Dr. Brad Hill from Nottingham joining us for that in 2 weeks' time, and we've got a chat function to sign up for that. Listen, all it leaves me to do is to say, other than say thank you to everyone for joining us, to say thank you to Nikki and Pat. I mean, that was brilliant. We just scratched the surface, but you've given us so much to think about, and as people can find that on our YouTube channel later on. But so to Pat and to Nikki, thank you so much. Nikki, I'll buy you a can of Red Bull when I next see you, and Pat, I look forward to seeing you very soon, and I'll give you a traditional glass of wine. I think it would probably be better. But thank you so much, and look forward to seeing everyone again in a fortnight. Nikki and Pat, thank you.
Thank you. Take care, everyone. Thank you.
Cheers, everyone.